For those living with kidney disease, food safety is an important consideration. Aside from making sure that you're following your prescribed renal diet plan, it's also important to be mindful of proper food handling to avoid foodborne diseases. Today, I'm going to discuss how to ensure that your meals are as safe as possible, especially if you have a kidney disorder. I'm going to provide helpful tips on eating right so that you can protect yourself from getting sick from contaminated food. So let's get started. Here's what you need to know about food safety when you're dealing with a kidney disorder. You might be wondering about who I am and why I'm qualified to talk about this. If you're someone living with chronic kidney disease, I've got great news for you. Hello, I'm Mathea Ford, a registered dietitian nutritionist specializing in chronic kidney disease and owner of renaldiethq.com. I specialize in helping people just like you improve their health by making simple yet delicious changes to your meals. Together, we can transform your eating habits, boost your overall well-being, and ensure that you're enjoying every bite along the way. Say goodbye to bland and boring meals and say hello to a healthier, more vibrant life. Let's get started on this incredible journey to better health together. Visit renaldiethq.com today and take the first step towards a healthier lifestyle. People with kidney failure are at a higher risk for infections due to compromised immune systems and other health issues like high blood pressure and potential electrolyte imbalances. Because of this, it's crucial for them to be vigilant about food safety to avoid foodborne illnesses. Contaminants such as bacteria, viruses, parasites, and toxins can be present in food, so knowing the source of food is essential. Safe food storage practices, including proper refrigeration and freezing, help prevent contamination and spoilage. Additionally, individuals with kidney disease should practice good hygiene by washing their hands thoroughly, using separate utensils for different foods, and ensuring food is cooked to safe temperatures to further reduce the risk of foodborne diseases. Let's talk about this. When eating out, especially if you have kidney disease, it's crucial to stay safe by being mindful of your dietary needs. Always inform your server of any allergies or dietary restrictions to prevent allergic reactions, and ask for allergen information on menu items. To avoid cross-contamination, especially with ground and raw meats, use separate utensils and cutting boards when you're at home. Consider cooking at home more often to have better control over your meals, which is also beneficial for managing blood pressure since you can use less salt. Home grilling offers many healthy options that can be safer and tailored to individuals with healthy needs. Home grilling offers many healthy options that can be safer and tailored to individual health requirements. Proper food storage and handling are crucial for meal prepping, especially for those on a renal diet where portion control is important to prevent cross-contamination. Utilize dissolvable labels to track storage details and adhere to safety guidelines by consuming leftovers within 3 days or freezing them and using appropriate packaging and choosing airtight containers. For extended shelf life, canning and jarring pantry staples is effective, ensuring that you have tight seals on jars. These practices, along with the understanding of the impact of different cooking methods on food spoilage, help prevent foodborne illnesses and maintain the quality of freezer meals that are both healthy and suitable for a renal diet. Now that we had a little discussion about how important food storage is, let's move on to one more critical factor in understanding risk factors for foodborne diseases: food preparation. It is essential to prepare foods correctly and safely by cooking them thoroughly at the right temperature. Moreover, when handling food, proper hand washing is essential to avoid contamination. Additionally, it's important to keep up with the proper labeling when preparing meals so that those with allergies can avoid any potential risks that may occur if an allergen contaminates their food. By taking these simple steps, you can ensure your safety while still enjoying your favorite meals. Eating healthy is important for people with kidney disease, so let's talk about some healthy eating guidelines. As part of following a low-sodium renal diet, being aware of potassium intake is also important, even on low-potassium side dishes. Following your dietary requirements will make sure you're getting the right nutrition while avoiding foods that could be harmful. You can make your own renal diet casseroles if you use the right ingredients to be safe and healthy on a renal diet. Let's review some guidelines for healthy food choices to help people with chronic kidney disease choose nutritious and safe foods. Managing a kidney-friendly diet is crucial for maintaining optimal health with chronic kidney disease. Such a diet typically involves a low intake of sodium, potassium, and phosphorus, and a limited intake of protein. Careful label reading, cooking methods awareness, portion size control, and preparing meals at home are key strategies to adhere to dietary recommendations. It's also important to avoid salt substitutes containing potassium chloride. And when eating out or opting for takeout, you should exercise caution and limit your frequency, as these may not offer the same nutritional benefits and even some extra sodium as home-cooked meals. Diligent attention to dietary choices can help prevent the progression of kidney disease. When it comes to people with kidney disease, consuming a low potassium diet menu is a beneficial way for you to maintain your health. Many healthcare providers suggest substituting high potassium items with lower potassium ones in your meal planning and cooking. For example, sweet potatoes and kidney disease go well together instead of white potatoes and kidney disease, or using garlic powder instead of garlic salt when seasoning meals. Also, be mindful of food labels when eating out or ordering takeout. Many restaurants provide nutritional information as part of their menus, and these nutrition fact labels can help you track your potassium intake. With careful consideration and some creative, healthy alternatives, anyone can enjoy a healthy, kidney-friendly diet while managing your CKD. Now let's talk about cleaning and sanitizing surfaces. When it comes to cleaning and sanitizing kitchen surfaces, it's important to use the right products. Make sure to read labels to check for any harsh chemicals. Additionally, sanitizing with a bleach solution is an effective method. When storing food, it's important to keep it away from potential contaminants. Refrigerating leftovers promptly is also a good way to keep food safe. Lastly, always wash your hands before handling food and avoid cross-contamination. People with kidney disease need to be cautious when selecting kitchen cleaning products to avoid excessive chemical exposure. It's important to read labels carefully to prevent introducing toxins into the food and to manage costs effectively. Purchasing products online can help provide more detailed information about the ingredients and help find safer options. Seeking out third-party certifications like those from Green Seal can confirm that products meet environmental and safety standards. Doing thorough research before buying cleaning products is crucial to ensure kitchen surfaces are sanitized without risking any health. When it comes to cleaning and sanitizing kitchen surfaces, there are many methods available. Preparing leftovers safely, handling seafood carefully, and cooking meats thoroughly can help reduce the spread of bacteria. For your kitchen tools and equipment, sanitizing is important to make sure all bacteria and other microorganisms are killed. You can use cleaning solutions to soak your kitchen utensils from time to time just to make and use a food-safe cleanser and rinse them well. You can also use chemical solutions to sanitize countertops and tables. From buying certified safe products to understanding how to best prepare food items, following those guidelines will make sure that you're doing all you can to keep your kitchen clean and free from potential contaminants, especially microbes. Scheduling and planning meals and controlling portions can help reduce waste, while handling leftovers properly will keep them safe for consumption. Make sure to put leftovers in the refrigerator or freezer within 2 hours after cooking or purchasing them. If the current weather conditions are hot, it is important to do this possibly within an hour. With mindful storage practices in place, you'll be able to enjoy delicious meals safely within the comfort of your own home. Eating fresh is one way to get the most out of your produce, but it's important to remember that washing fruit and vegetable items properly can help protect those with kidney disease from foodborne illnesses. To clean raw produce, we should always use running water and gently rub the surface of the item, getting rid of any extra dirt that you might see. This simple step during food preparation can be potentially life-saving, especially for renal patients. Additionally, it's good to be aware of any potential risks of contamination when it comes to buying fruits and vegetables, such as buying pre-washed produce or avoiding produce with cracks or bruises. Lastly, always wash your hands before and after handling produce to keep yourself safe. Fresh produce is an important component of a renal diet, so washing fresh fruit items and vegetables, as well as the utensils used to handle them, is important. It's especially crucial for people with kidney disease, as they may be more vulnerable to infections caused by contamination due to their weakened immune function. Sanitizing utensils before and after use is also necessary to prevent cross-contamination. When using chemical cleaners, make sure to rinse your kitchen tools well. Most of the time, warm soapy water with antibacterial dishwashing solution can do the trick. To prevent further cross-contamination, make sure to use separate utensils and dishes when handling cooked and raw food, raw meat, and other food items. Cross-contamination is when you accidentally take the raw bacteria that's on a raw product, like a vegetable or a protein item that's going to be cooked, may have bacterial contamination. And so you use a utensil on that. And then instead of washing it in between, you use that utensil or that cutting board immediately after on a cooked item. So the raw item, even though it may have a bacterial contamination, it's killed when you cook it. But if you use that utensil on a raw item and then on a cooked item, you didn't have the opportunity to kill that bacteria. So then you cross-contaminate the food and you potentially have bacterial contamination of a cooked product. So making sure that you wash your kitchen tools between, including your cutting board, is very important. Refrigerating and freezing foods is an important part of food safety for people with kidney disease. It's important to store the food at a safe temperature in order to preserve its quality and nutrients. Let's talk about the storing temperatures. It's important to store food safely in order to maintain a healthy diet and prevent disease, especially for those with kidney disease. That being said, refrigerating and freezing foods at the right temperatures is essential. It not only helps keep food fresh longer, but also prevents harmful bacteria from growing that can lead to serious health complications down the line. Make sure any perishable items are kept in a refrigerator at a temperature of less than 40 degrees Fahrenheit to prevent the growth of bacteria. Also use airtight and covered containers when refrigerating foods to help keep them fresh. Freezing not only helps preserve our meals for longer periods of time, but it also keeps us safe from any potential illnesses from bacteria or other microbes that might grow. When freezing foods, make sure it's put in the freezer at 0 degrees Fahrenheit or lower as soon as possible. It's important to note that if you're going to freeze your food, remember to label all food packages with a date so you know when they were put in there, also with the name of it. Additionally, check on them regularly since some frozen foods have a shorter shelf life than others. Finally, keep an eye out for any signs of freezer burn, like discoloration or ice crystals forming on the surface, as these could indicate that something isn't quite right with the item in question. Once you have the food safely stored away in your refrigerator or freezer, it's time to think about defrosting techniques. When defrosting foods, avoid using hot water or a microwave at high heat, as it can make the food unsafe to eat. Instead, defrost food in the refrigerator, in cold water, or in the microwave with the defrost setting. Lastly, make sure to cook food immediately after it's been defrosted to ensure proper food safety. When it comes to purchasing food, it's important to look for labels that indicate the product is suitable for a renal diet. When it comes to expiration dates, it's important to check those carefully and make sure that the food is still safe to eat. Food preparation methods should also be given attention, as a lot of harmful contamination can occur at this step, like I talked about with the cross-contamination. When it comes to food purchasing, kidney disease patients need to make sure they are making the right choices. Buying locally is a great way to ensure freshness and high quality of your produce. Label reading can help you avoid foods with too much sodium or phosphorus, which could be harmful for people with kidney disease. Using a renal diet grocery list to shop is the key. Budgeting tips such as buying in bulk and taking advantage of sales at stores can also aid in saving money while still getting what you need. Making sure food is safe to eat and avoiding any potential harm from improper cooking or storage techniques are important for individuals living with kidney disease. One of the key elements of ensuring safety is understanding expiration dates. It's essential to know when your food will expire so you can plan meals accordingly. At many steps of the food preparation process, checking the expiration dates is important, especially for ready-to-eat foods. This can be done during shopping, prior to storing, and before opening any food package for consumption. Beyond the expiration date, the food may have deteriorated in terms of safety and quality, hence it may not be advisable to consume them. So make sure that you're doing both a visual check and a look at the expiration date to make sure the food still looks like it's at good quality. When cooking, it's crucial to adhere to recipe instructions, especially concerning cooking temperatures and times. Ingredients should be used within their freshness period for optimal taste and safety. Food labels are a valuable source of information about ingredients and aid in meal planning. Maintaining cleanliness with utensils and surfaces is essential to prevent bacterial contamination. And for individuals with kidney disease, cooking methods such as boiling, baking, roasting, grilling, microwaving, and steaming are preferable. These techniques avoid the use of frying and the excessive use of salt or fat, promoting safer, healthier consumptions for those with dietary restrictions. Reheating temperatures are important to keep in mind when it comes to food safety, especially for people with kidney disease. It's important to reheat leftovers properly to avoid any contamination or foodborne illnesses. The key to reheating is to get your meal hot enough that bacteria doesn't survive. The ideal internal temperature for this is 165 degrees Fahrenheit or 74 degrees Celsius. To reach this temperature, use a food thermometer when possible and make sure all parts of the food are warmed through. If you don't have a thermometer handy, simply heat things up until they're steaming hot, but do check with a fork or spoon just in case. It's also worth noting that some cooked dishes can contain harmful bacteria even after being heated. So always give them an extra few minutes on the stovetop or in the oven before sitting down to enjoy your meal. All these steps will ensure your meals are safe from microbacterial contamination every time. Reheating leftovers is a great way to save time and money, but it's also important for food safety. So when you're reheating cooked dishes, be sure to pay attention to the portion sizes, cooking methods, and expiration dates listed on the food labels. Properly handling your foods can help prevent contamination from bacteria that could make you ill. Stir during the reheating process to ensure the food is cooked throughout. When reheating leftovers, it's crucial to ensure food safety by considering the storage, packaging, and adjusting thawing and reheating times accordingly. Microwaves are convenient for reheating, but food should be stirred to distribute the heat evenly. Alternately, ovens or stovetops can be used to guarantee thorough cooking. It's also essential to monitor the temperature of microwave food to prevent burns. This is particularly important for individuals with kidney issues who need to avoid foodborne illnesses. For the best safety, consume reheated meals immediately to minimize the risk of contamination from being left at room temperature for too long. People with chronic kidney disease can protect themselves from illness from food by being mindful of their special diet, taking safety precautions in the kitchen, and having a healthy lifestyle. Eating foods that are beneficial to them while avoiding those that are not is key. Simple habits can make a difference. Cleaning hands and surfaces regularly, cooking meals thoroughly, and keeping raw meat away from other ingredients will help people with CKD avoid foodborne illness. If you enjoyed my talk today, please subscribe to our YouTube channel. We have lots of great content coming up.